What are the applications of vessel wall MR of intracranial atherosclerosis?
Well, there are several. As I talked about, there is the identification of occult lesions that are on angiography. Vessels are capable of remodeling in their ability to accommodate plaque formation, and angiographically they can't be detected. But by wall imaging, we can pick them up, and in fact, this is particularly important for posterior circulation plaques that have a great ability to remodel. And also we can identify plaque features that are indicative of stroke risk. We can look for enhancement as a sign that the plaque may be a culprit lesion. Perhaps that means it can be linked to a stroke, and it puts it at a higher risk for future stroke. That can give us some insight into which plaques are at risk for future strokes.
And what are the conclusions of ERIC study?
So, well, there's probably not enough time to go through all of our conclusions, but the ARIC study, which is the Atherosclerosis Risk and Community Study, was a very large population-based study that's ongoing. And in this study, we looked at intracranial atherosclerotic disease using vessel wall imaging techniques and MR angiography. And we found the prevalence of intracranial atherosclerotic disease to be quite high. In fact, it was quite a bit higher than anyone had expected. 34% of 34% prevalence. That's a weighted prevalence to the U.S. And in black men, the prevalence was as high as 51%. So these numbers were very high. Of course, it's an older age group. 65 to 90 was roughly the age range. And also, we saw that the effective age was different for each, for gender and race. And at around age 78, we saw prevalences start to really take off, especially for white men and black men. And some of the rates approximate the stroke rates that we see reported by the CDC. So it gives us some insight into the mechanisms or the reasons for stroke prevalence and racial differences as well as gender differences in stroke from intracranial atherosclerotic disease.
And what is the high isotropic resolution 3D MRI?
So that's a technique that allows us, it means that we're using a high resolution picture of a vessel with an imaging element or voxel that has dimensions that are equal. So, for example, 5 millimeters by 5 millimeters by 5 millimeters would be a voxel size that's isotropic. And the isotropic resolution allows us to reconstruct two-dimensional planes through any orientation of our 3D volume. So we can identify a vessel, reconstruct a plane through the long axis or the short axis of that vessel quite nicely, and allowing us to analyze a black blood image after the patient's long gone from the exam room. So we can do this as a post-processing procedure, and allows us for a very robust analysis of our vessel wall studies.